I mean, you talked about the economic impact, but in places like mine in Luton North, we actually got the lowest money from Eat Out to Help Out, only £25,000. You've claimed nearly double that in takeaways for your own team. So I'm just going to ask a couple more questions about Eat Out to Help Out and whether you believe that that was the right thing to do for the health of the nation. In making big policy decisions like Eat Out to Help Out and the restrictions in the tier structures that soon follow, why don't you and will you consider publishing risk, impact and possibly transmission assessments for places like restaurants, pubs, gyms, schools and outdoor activities?
Well, Jenny can speak to the science around the transmission of individual places, but I just wanted to pick you up on one thing. I haven't claimed for anything, right?
No, I've asked you specifically whether you will publish risk assessments for places like restaurants, pubs, gyms, schools and outdoor activities.
Well, I was going to ask Jenny to come in on the already enormous amount of published information.
I'm sorry, publishing those assessments is within your power, not Jenny's.
I'm terribly sorry. I was answering a specific accusation in the first question, which I reject. You mentioned the amount of meals that we provided in the department and for the NHS, by the way, during the peak. And I will defend to the death the fact that when people are working 7 days a week, 18 hours a day, then it's perfectly reasonable that we should feed them. And that is, I think my team are amazing and have pulled an amazing shift this year, and they deserve to be fed whilst they're doing that work. And I joked on the radio that this is probably the best value for money food that you could ever buy, because it allowed the people who are working so hard to tackle this pandemic to keep working. And as for the accusation, which I don't know whether it was intended or not, that I personally had claimed for anything, is completely wrong. I have, like any minister, I have absolutely no personal interest in any of this other than saving lives for the nation. Having said all of that...
Okay, so in terms of saving lives for the nation, will you publish risk, impact and or transmission assessments for things like restaurants, pubs, gyms, schools and outdoor activities, particularly when you have big policy decisions like Eat Out to Help Out?
So I was going to come on to that other part of your question and ask Jenny Harris to come in to describe the evidence that we have already published in this space. So the reason that I'm doing it that way is because we already publish a huge amount of evidence, as much as there can be. Now, the evidence isn't perfect because this is an imperfect science.
Why didn't you publish the risk or impact assessment on Eat Out to Help Out before taking that decision?
Because we make decisions based on what we think is the best balance in a difficult circumstance where the evidence base is imperfect. And maybe Jenny can set out the evidence base that we have, which we extensively publish.